More now on the Delta variant and how it's shaking up the pandemic response. We're joined by CBS News medical contributor Dr. David Agus, who joins us from Los Angeles. Doctor, good morning. A million vaccinated, a million plus in a day sounds pretty good. Are we moving right now in the right or wrong direction?
Well, we have a new enemy. So the data are changing. And so, the only way we know how a virus behaves is from real world evidence. And what we're seeing now is that this virus can spread like crazy. We're trying to counter vaccines, but we're not winning. 100,000 cases on Friday. But anybody who says, well, the fact that you can get a breakthrough means the vaccines aren't working is wrong. 97% of current hospitalizations are those who are unvaccinated. So the vaccines are working remarkably well in terms of preventing serious illness and death, which is critical.
Talk to us about these new guidelines. Mask mandates are back in flow in many cities and states. Who is this directed at specifically?
It's directed at you. No, it's directed at everybody. What we're seeing is, even people who are vaccinated and when they're exposed to the new Delta variant, they can potentially spread the virus. So really, whenever there are people congregated together, you need to wear a mask. If you have young children at home, elderly or people with immune suppression, you probably want to wear a mask around them presently. We're in a new game, and the new game is the Delta variant, and we have to change what we do. The science isn't changing, the virus is.
Well, Dr. Agus, do we know if breakthrough cases can actually result in long COVID? Because we hear about these breakthrough cases being quote unquote mild, which is a range of severity from what I understand. But is there enough data to actually understand whether long COVID is a possible consequence of a breakthrough case?
It's a great question, and one I get a lot. And right now it looks like if you have immunity from the 2 shots of Pfizer or Moderna or 1 of J&J, and you are exposed, even if you're mildly symptomatic, you will not get the associated long COVID symptoms. And we're not really seeing that, and there haven't been many reports of that. And that is good news, right? You get a mild cold, which while we wish it didn't happen, there are going to be some breakthrough symptoms, but they're short and they go away.
Doctor, can we just clear one thing up? Because I think we've seen some confusing headlines this week. One of them saying that vaccinated Americans can pass along the virus just as easily as unvaccinated. That's not true, correct? If you get a breakthrough infection, you can, but breakthrough infections are so rare. So are some of these headlines confusing people?
No question about it. They make declaratory statements out of context. And so what we're seeing in many of the cases where there's a significant number of people exposed and people who are vaccinated, you're going to spread it there. If people who are vaccinated, some may get mildly symptomatic. Can they transmit to others? Most probably. Really hasn't been shown definitively, but it's probably at a much slower rate than if you were unvaccinated. And I think that's really important. The vaccines are working. They are not 100% perfect, as no vaccine ever is, but they're doing what they need to do now. And we as a country have to step up and continue the vaccination rates at a much higher pace than we're doing now, or we're going to be in real trouble over the next several weeks.
Okay, Dr. Agus, thank you very much. Again, the vaccines work. It just takes time. Elaine.
Thanks, Jeff.